Richie Mae Pintor live at your screen once again. For today's return demonstration, I would love to show you the proper procedure of the perineal care. So first of all, let's define what is perineal care. So perineal care is the aseptic cleansing of the vulva and the perineum. So for the assessment, first we have to review general assessment data about the patient. Second, observe the 4 signs of perineal itching, burning, underurination, or skin irritation. Third, assess patient's ability to bath him or herself and to perform perineal care. Fourth is we have to assess patient's learning needs related to perineal care. And lastly, while providing the privacy, assess the perineal genital area for abnormalities. So for the objectives, first we have to keep the vulva and perineum clean. Second is to promote healing of the perineal wound. Third is to prevent infection. And fourth is to prevent disagreeable odor. And lastly, to provide comfort. So we have the considerations. So the flushing water should be of the right temperature to avoid burning the patient. Second, observe special care when a patient has a perineal wound or stitches to avoid much discomfort. And third is if the patient defecated or voided, empty the bedpan first before giving perineal care. Fourth, discard used perineal balls into the waste receptacle, not into the bedpan. So for the equipment, flushing tray containing first, a pack of dry perineal balls, bottle of sterile soap, soothe solution, flushing pitcher with warm sterile water. Pick up 4 steps, soap inside the aseptic solution, expression sterile 4 steps, raised receptacle, preferably a Mrs. Basin, lined with paper. Ordered medicine, tissue paper, rubber protector if necessary. And also bedpan, perineal pad if necessary, bath towel, and also gloves. So for the preparation, first we have to explain the procedure and its purpose to our client. Then, screen the patient. Remove perineal pad if any. Wrap it with paper and discard into the waste can. Now let's go to the procedure. First, we have to loosen the put part of the top sheet and place patient in dorsal recumbent position because this position allows the patient to lift herself into the bedpan. Second is we have to place rubber protector against patient's buttocks. Rubber protector protects the beddings from getting wet. Third is we have to place the patient on bedpan. Fan fold top sheet towards the least to explore vulva and perineum. Put a bath towel over the abdomen. Because providing privacy avoids overexposure, bath towel protects the from soilage. Next is we have to pour sterile water over the vulva. Because rinse off urine, fecal, and vaginal drainage using warm water. Warm water helps in relaxation of nerves and knees. Fifth is we have to clean the vulva and perineum using perineal balls, soap, and solutions. Contamination from the reg area is prevented by using a downward stroke. Cleansing area, there are few ordered organisms before minimize the spread of organisms to cleaner areas. So the use of a downward stroke in the following sequence is first, center of the vulva, second, farther labia majora, third is the near labia majora, and fourth is the farther labia majora, fifth, near labia majora, and next is the last. Then we have to clean. Repeat the procedure as necessary. To clean, discarding the used balls into the waste receptacles prevents the spread of microorganisms. 7 is we have to rinse area with warm water. See to it that the solution is completely rinsed off. Soap that is left on the skin on the mucous membrane may cause irritation. 8 is we have to dry the vulva with the dry perineal balls following the same sequence in cleansing. This enhances patient comfort. Wet or moist environment causes bacteria growth. Next is we have to remove the bedpan and turn patient near you. This position makes it easier to dry buttocks and anus. Working close to an object prevents overstretching, which may cause massive strain. Next pan is to dry buttocks and anus using tissue paper. Tissue paper as a mechanical means helps the cleaning the area. Next is to assess patient. To assume a dorsal recumbent position, apply medication if ordered, and in perineal bath that is necessary. Prompt attention to details of patient's comfort and confidence discharges perineal area and prevent the perineal pad. So always we have to remove the bed protector. It is optional and the bedding is comfortable. And orderly environment is conducive to health and keeps the unit clean and neat. So we have to clean our equipments before leaving and make our patient comfortable. Sir, ma'am, are you okay? Comfortable? Yes. So, that is our basic perineal care. I hope you learned something and enjoy my video. Once again, I am Richie Mae Pintor from BSN2A live at your screen. May God bless us all. Thank you so much for watching. Have a good day, everyone. Bye.
Essential here to show the real, pure and natural.